Cancer Prevention and Screening. This is one of a series of cancer videos that can be found on the website aboutcancer.com. I'm dictating this in 2019, and the guidelines will continue to evolve, and I've listed the best reference websites here. First question, overall prevention strategy. Can you lower the overall risk of getting any type of cancer? There are 1.7 million new cases this year, 600,000 deaths. 39% of men will get cancer and 30% of women. The probability of the most common cancers are listed here. The best approach to cancer would be to prevent cancer in the first place. Some things are obvious, such as avoiding known carcinogens. Screening would be also an obvious good solution. According to the NCI, in order to reduce the incidence of cancer, there are at least 4 things to consider. 1, avoiding a carcinogen in the first place. 2, pursuing a lifestyle or dietary practices that will modify risk factors or your genetic predisposition. 3, medical interventions. Are there specific drugs or risk-reducing surgery that's worth considering? And then 4, early detection strategies. A recent study showed that there are 4 lifestyle factors that we should all practice. 1, never smoke. 2, avoid getting obese. 3, get active physical activity. And 4, eat a healthy diet. If you pursue all 4 of these, you can lower your risk of cancer by about 1/3. And in fact, if you look at this German study, you can reduce the risk of type 2 diabetes by 93%, heart attack by 81%, a stroke by 50%, and cancer by at least 36%. The same sort of strategy of healthy lifestyles will even prevent dementia. The study recently published, even patients who are genetically at risk for Alzheimer's, if they practice 4 healthy lifestyles, a healthy diet, proper exercise, no smoking, and moderate alcohol, even if they had a genetic risk of getting Alzheimer's, they could significantly reduce the likelihood this would happen by pursuing a favorable lifestyle. So what are the risk factors for cancer? Here's a list from the NCI. I'll address some of these in more detail and some of these quite briefly. Age is the first obvious thing. You can see from this table, most cancers really don't show up until the patient is 70 or older. So in fact, 82% of the cancer in men won't occur until you're 70 or older, and in women, 69% when you're 70 or older, which ironically occurs at the point when screening may often be stopped. Alcohol has been known to increase the risk of cancer. The most common one here is breast cancer, and even moderate drinking can increase the risk of breast cancer as shown. The guidelines recommend, if you drink at all, moderate alcohol consumption, which is 1 drink per day for women, 2 drinks for men. You can see from this data that the most common cancer associated with alcohol is female breast cancer, and you can see the parts of the country where alcohol consumption is higher. And there are other cancers as listed. Cancer-causing substances in the environment should be avoided. Here's again the current list from the NCI. Recently they described the question of Roundup. Does this cause cancer or non-Hodgkin's lymphoma? And there's a debate as I dictate this in 2019. There are lawsuits. The science behind this is still unclear. Chronic inflammation, even the microbiome in the bowel may affect cancer. There's some evidence that if you take anti-inflammatory medications, such as aspirin, you might lower your risk of cancer. This is debatable. Recently, Up to Date suggested that aspirin should not be used routinely to prevent cardiovascular or cancer. This is still debatable. Diet. There are hundreds of books on cancer prevention diets. With few exceptions, however, studies of human populations have not yet shown that dietary components will protect against cancer. One of the few exceptions was a recent study just published from the Women's Health Initiative. They looked at 48,000 women. They put them on a low-fat diet, and it did, in fact, reduce the risk of breast cancer by 21%. The importance of dietary fiber in preventing colon cancer has been discussed since the time of Burkitt back in the 60s. However, multiple studies have had trouble confirming this. For instance, there was a decreased risk of cancer in 5 large studies, but then the nurse health study and the women's study showed no protective benefit. There were 13 studies that showed fiber intake was inversely associated with cancer, but then it was no longer apparent with more follow-up. There was a meta-analysis that looked like this would reduce cancer, but then there were several large randomized trials that showed no protective effect and 5 other studies that showed no effect. This just points out how difficult it is to do long-term longitudinal studies on diet and cancer. How about vitamins and micronutrients? This is from the NCI's current website. 38 studies have found no benefit from taking vitamin C or vitamin E. An NIH consensus report showed there was no evidence to recommend vitamins and nutrients. A large randomized trial, 8,000 women, studied for 9 years, showed no benefit from vitamin C, E, or beta-carotene. Additionally, other long-term studies, 160,000 women, showed no long-term benefit. There are evidence that some of these vitamin intervention studies may in fact backfire. There was a large study using selenium and vitamin E to try to prevent prostate cancer. 35,000 men were studied. This was a so-called SELECT trial. It turned out it backfired. There was no benefit. And in fact, a long-term follow-up study showed it actually increased the risk of prostate cancer, at least in vitamin E. Beta-carotene is another good example of these nutritional interventions that don't work. There were 30 studies that showed people who ate more vegetables and had more beta-carotene had a lower risk of lung cancer. But when they tried to do an intervention trial, large controlled trials of beta-carotene, there was no benefit. In fact, there was increased lung cancer. There were 29,000 male smokers in the ATBC trial, and in fact, they had an 18% increase in lung cancer. And there were 18,000 people in the CARROT trial, and they had a 28% higher risk of lung cancer. And so you can see the data here. This was published in the New England Journal back in the 1980s. Both trials showed increasing lung cancer from beta-carotene. Hormones, it's been known that estrogen will increase the risk of breast and uterine cancer. Then studies said if you add progesterone to estrogen, you will lower the risk of uterine cancer. However, added together, estrogen and progesterone will increase the risk of breast cancer. So this is quite complicated. Immunosuppression has been known to increase the risk of cancer. Transplant patients who are on immunosuppressive drugs get more cancer. People with HIV get more cancer and are more prone to infectious agents that can cause cancer. According to the NCI, there's a list here of viruses, bacteria, and parasites that can cause cancer. If you just focus on one, human papillomavirus, or HPV, it's been known for years that this causes multiple types of cancer. Cervix is the most common associated with this, but recently oropharynx cancer has been found to be related to HPV. Oropharynx would be specifically the base of tongue, palate, and tonsil. And since the turn of the century, HPV-related tonsil cancer has exceeded dramatically the risk of smoking-related cancer. And of course, Gardasil and some of these vaccines are designed to lower the risk of getting HPV infection, and is certainly recommended in children. Obesity has been shown to increase the number of cancers, as shown here. The one most specifically related to that is postmenopausal breast cancer, and multiple other cancers as noted. Radiation has been long known to increase the risk of cancer, ionizing radiation. There's a website, xrayrisk.com, and for instance, if you put in an older man getting one hip x-ray, what's the odds that will increase his risk of cancer? It's extremely low, 1 in 37,000. On the other hand, small children, if they got multiple CAT scans or PET scans, it could significantly increase the risk of cancer. Sunlight, particularly ultraviolet radiation, or tanning boost, has been known to increase the risk of skin cancer. Smoking is the most obvious and well-known carcinogen. 480,000 premature deaths every year. 36% of these are from cancer. The list of cancers related to smoking is quite lengthy, as noted. Lung cancer is the most obvious one, but multiple cancers are shown here. Even smokeless tobacco, cigar use, and secondhand smoke can cause cancer, as shown here. At the turn of the century, it was snuff, chewing tobacco, and pipes, but since the 20th century, it's been mainly cigarettes. It's interesting to look at the growth of smoking. After World War I, this shot up. By World War II, many people were smoking cigarettes. Then in the 60s, with the Surgeon General's report, this started to taper off. As non-smoker movements and banning advertising hit, raising taxes, limiting who could sell cigarettes, we've seen the numbers drop off. It's of historical interest to see the peak for men was almost 80% back in the 1940s, and with women it was almost 50% back in the 1960s. Men stopped smoking in a much steeper decline starting in the 50s and 60s. The incidence of lung cancer doesn't start to come down for 15, 20, or 30 years, as noted here. It didn't really fall in men until the 1980s. And in women who cut back a little later and less dramatically, the incidence of lung cancer in women really didn't decline until 2008 period. And you can see from these tables, lung cancer mortality in men didn't start declining until the 1980s and 90s, and women really didn't start declining until the 2000s. The most current stats, as I dictate this, 15% of men smoke, 12% of women. It's become now a lower socioeconomic phenomenon. Uneducated people, 36% may smoke compared to graduate level people, 4%. It's also low socioeconomic. People who are poor, 21% may smoke compared to rich people, 7%. People who have insurance such as Medicare, 8% smoke, but uninsureds may smoke 25%. In parts of the country, obviously the tobacco belt, poor states like West Virginia have the highest rate of smoking, 26%. Utah, because of the Mormons, the lowest, 8%. Genetics obviously causes cancer. There are inherited germ cell genetics that causes cancer, but most cancer is due to somatic or acquired changes. Again, your DNA exposed to carcinogens. There are other interventions that have been shown to lower risk. Taking tamoxifen or raloxifene can lower the risk of breast. Finasteride will lower the risk of prostate, but it backfired. I'll show that in a second. The COX-2 inhibitors may lower cancer of the colon, but can cause heart problems. The same with aspirin, causing bleeding. The prostate cancer prevention trial used finasteride or Proscar. Yes, there were less cancers, but there were more of the Gleason 7 cancers, and those are much more serious, so this really backfired. This is from the NCI, studies on vitamins that have clearly not been shown to be of benefit. Physical activity is felt to definitely lower the risk of at least several cancers. Colon, breast, and endometrial is noted. However, almost all these exercise studies are observational studies, and it's not clear if this will truly prevent cancer or this is just associated with people who are healthy. But the number of cancers felt to be affected by exercise are shown here. Breast cancer is the one most commonly linked. There are dietary guidelines. This is from the government's most recent website analysis. Only about 57% of people eat healthy according to their data. Healthy means a variety of vegetables and fruit, as noted, avoiding sugar, fat, sodium, as noted, and excessive alcohol. And then exercise. Exercise has clearly been shown to be beneficial. Regular physical activity has been linked to lower risk of breast and colon cancer. However, only 20% or less than 20% of seniors are getting the proper exercise. The best advice is avoid inactivity. Get at least 150 minutes of exercise each week. Try to spread aerobic activity out and do muscle strengthening activities at least 2 times a week. If you ask, are there specific things for specific cancers? Again, the NCI website here is very good for this. Just as an example, I put in uterus cancer. If you do, you'll see this website. There's a professional version, which is very good. There's a screening section. There's a prevention section. And there's even a video that's very good. If you click on endometrial or uterus cancer prevention, you would get a screen like this. Things that increase the risk, estrogen, tamoxifen, obesity. Things that lower the risk, pregnancy, progesterone along with estrogen. Actually, cigarette smoking will lower the risk. Things that haven't been shown to be beneficial, weight loss, fruit, vegetables, vitamins. Smoking, you would say, is that correct? And the answer is actually yes. Evidence that increase in smoking lowers the risk of endometrial cancer. It has an anti-estrogen effect. There's no specific cancer screening for endometrial cancer. A transvaginal ultrasound may have use, but that's not a standard screening. Finally, where is the best screening advice for cancer? Probably the best site would be simply go to the U.S. Preventative Task Force website. I've got the link listed here. You can actually download the app into your phone, and it's very good. You only have to enter basically 4 questions, and it will rank their advice A, B, C, D, and I as noted here. If you put in a 70-year-old man who's a non-smoker, it would basically only list colon screening. If you put in a woman as a smoker, it would list lung cancer screening, breast cancer screening, and colorectal cancer screening as noted. And they give you even more details. If you download this app or go to the website, it will explain risk information or details, so it's quite educational, and you will get a lot of good information. So finally, general lifestyle recommendations: avoid tobacco, be physically active, maintain a healthy weight, eat healthy diet, limit alcohol, avoid sexually transmitted infections, avoid excessive sun, and get regular screening, at least for the things that have been clearly shown to be helpful: breast, cervical, colorectal, and perhaps smoking screening or lung cancer screening in people who are smokers or high risk. All this information and more can be found on the website aboutcancer.com.